Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 4 additional deaths due to COVID-19, 2 in the northern region, 1 in Southern Health Santé Sud, and 1 in the Winnipeg region. I'd like to extend my condolences to their loved ones, their family, their friends, the caregivers. The current 5-day COVID-19 test positivity rate is 5.9% provincially and 4.2% in Winnipeg. 53 new cases of the virus have been identified as of 9:30 a.m. 1 case has been removed for a data correction, bringing the total cases today to 52. The total number of lab-confirmed cases in Manitoba is 30,289. We continue to make updates on our active case numbers. We've been reviewing older cases, and you'll see have been able to close a number of the active cases, and so you'll notice a significant drop in the total of active cases. That's both total and the numbers in the hospital. You know, our numbers today are again trending in the right direction. So these are numbers the lowest we've seen since early in the fall. Our ICU numbers are the lowest they've been since late November. And this is all the result of the work of Manitobans. We can see that the restrictions that we have in place are quite tough. They affect Manitobans to different degrees, but they are working. The numbers show us that they're effective. They're working, and has put Manitobans back in a position to continue our slow, cautious reopening. And we announced last week what that reopening could continue to look at. We can't undo all of this hard work by simply opening everything up again. We have to remember that we've been here before. If we open things up the same as we were in October, we will see November and December numbers. We just know how this virus is spread. Nothing has changed since that time. We've been able to vaccinate some of the highest risk Manitobans, but certainly not to a level where we can have any population level benefit. We continue to roll out those vaccines, and that's the hope that we've all been looking for. We know pandemics come to an end, and this one will be no different. But right now, we need to stay focused to keep these numbers down, to keep the strain of our healthcare system down, so we can get back to the healthcare for all Manitobans. And so that's why we're taking our time with the reopening. We're doing things very intentionally to ensure we don't, again, see widespread community-based transmission. So with these reopening plans, and there'll be more details coming later in the week on exactly what the reopening will look like. But we have to remind Manitobans and businesses that we know it's been very difficult, but again, we can't be looking for loopholes to try to get things open that aren't intended to be open. We know with each opening, we hear of businesses trying to skirt around the orders. Remember, if we go back to where we were in October, we will see our November numbers again. And we just don't have an alternative but to put the restrictions back on. So if we go too fast, if we have too many Manitobans trying to work around the cautious approach, we could see ourselves needing to put restrictions on again. And we don't want to go backwards. So let's have this cautious reopening. We know there's hope in the horizon with the vaccine. We know there's hope because our numbers have been coming down as well, but we have to continue to be cautious. We've talked about stigma in the past, and it's always relevant when we're dealing with outbreaks. We're hearing, again, reports of individuals who are critical care workers, essential workers, who are being denied services. Even their children are being denied services. So again, when we stigmatize groups, we risk driving those groups away from things like testing and the public health measures. So we can't stigmatize groups. So we have reasons that we have critical workers and essential workers. We have protocols in place for sectors on how to function. And none of those protocols include stigmatizing people. So please, we know this is a difficult time. People are worried about their safety, the safety of people around them, but we need to ensure we're practicing the fundamentals. But those fundamentals do not include stigmatizing groups. So please be kind, and let's all get through this together. And like we said, we will be getting back to normal. It's just not right at this time. And so with those fundamentals, those will be with us for quite some time. Staying home when ill. You've heard me mention a number of times of people with very mild symptoms still out and about. You heard me mention somebody having 60 plus contacts because of that. And so if we want to continue our opening, there's going to be much more risk now for people to interact. So if somebody's out when they're symptomatic, we're going to start seeing that community transmission again. So it's incumbent on all Manitobans. Stay home if you're sick, even if it's mild illness, get tested, and self-isolate pending those results. We want to wear a mask appropriately, wash your hands frequently, stay home and self-isolate if you're waiting for a test result, or certainly if you've been advised to self-isolate either because you're a case or a contact. And same thing goes, if someone in your household is waiting for a test, have that entire household wait pending those results. This is our way forward. We need to be aggressive with having people self-isolate who could be at risk of having COVID. We'll continue to work on those fundamentals. Just a reminder of the FastPass testing. The eligibility has been expanded, so all Manitoba childcare providers working in licensed childcare centers, nursery schools, family group childcare homes. This includes eligible early child development specialists or autism applied behavioral analysts and consultants. And so all Manitoba school staff and licensed childcare providers are now eligible for rapid testing at the FastPass site, 1066 Nairn Avenue. Finally, we're in quite a cold stretch right now. And so cold weather is certainly needs to be taken seriously, can have major impacts on health, frostbite, hypothermia, and so these can be prevented for the most part. And so we want people to ensure to plan their time outdoors, limit their time outdoors if possible due to extreme weather. Make sure you're dressed appropriately. If you have extra cold weather clothing or can help Manitobans' unsheltered population in other ways, please consider doing so. So thank you, and happy to answer some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Roussin. Our test positivity rate in Winnipeg is decreasing, and if it stays on that trajectory, it will have been below 5% for 2 weeks as of this Friday. So at this time, how does the test positivity rate influence public health decisions on reducing restrictions in the Winnipeg region?
Yeah, and so the test positivity rate's been, always one factor that we consider. It's an important factor, especially when we have relatively stable testing numbers. It can guide us on just what we're seeing in the community. So just like things like the total test volumes, hospital capacity, this is one of many factors that we consider moving forward, and we'll continue to look at that. And so, looking at our test positivity rate, in January 25th, our test positivity rate was up around 10%. And so we've made significant progress, and the plan is to continue that progress. So we're going to have this cautious reopening, but this is definitely one indicator that's part of many that we continue to follow.
Thanks. And so considering the number of tests being done on a weekly basis, is the Winnipeg test positivity rate like a reliable barometer on COVID-19 transmission? What do you think it says about the current COVID situation in the city?
Yeah, so again, it's one indicator, but when you look at relatively stable test volume, when you see that, then we can rely a bit more on that. If the test volume was highly erratic, highly variable, then the test positivity is difficult to see. But we had a fairly stable test volume, and over time we've seen total cases coming down. And then at the same time as test positivity coming down. So it does seem to be a fairly good indicator of the amount of transmission we're seeing right now.
From Global News, Amber.
Hi, Valentine's Day is coming up, and we're just wondering if you had any guidance for singles this year.
Yeah, so I think, like we said, these restrictions have been difficult on, probably all Manitobans and at various degrees and in various ways for individuals. And so I think that as we're opening up things like restaurants, where we're being very cautious, where we know that prolonged indoor contact is where this virus thrives. And so we're limiting it to household contacts. We don't want to have a number of contacts all of a sudden out in the community, or we're just going to be back in November. And so certainly that makes things more difficult for people who don't live with anyone, or wanted to spend that time with people who are not in their household. So of course, singles, if they're involved in a relationship, then they're designated two people, could have included the people they're involved with. But as right now, we want to limit the amount of contacts we have outside of our household. So we know in households you have that two-person designated limit, and we have outdoor group sizes. But right now, this is going to be quite a different Valentine's Day than what we're used to.
My follow-up question is about Valentine's Day and kids. Are there any best practices for safely exchanging Valentine's Day cards in schools, or should that not really happen this year?
I think there's our partners in education have done a tremendous job with safety protocols. And so I think what's really important is that we continue with the screening and the distancing. The typical thing we would say is to not necessarily share a whole bunch of things, during this time. When we're talking about paper and cards, this is relatively low risk. But I think, again, overall, if we could just limit the amount of unnecessary risk we take, I think it would probably be best to not have widespread sharing of items, if at all possible. But again, up to now, we know that education has done such a tremendous job at decreasing the amount of spread of COVID-19 within our schools, and so I'm quite confident in their ability to risk manage this type of thing.
From the Brandon Sun, Michelle.
Good afternoon. My first question is from an elderly woman. I would like to know how we receive the phone number to make an appointment. I am 80 and live in a rural small town. Do we get a notice? We feel very isolated. And I swear, I tried to find a phone number everywhere for her, and I just can't find one. What can you say to this woman?
And phone number you're referring to, like booking an appointment when eligible for a vaccine?
Yeah,
Okay.
yeah. She's 80, and I'm thinking there must be a way for her to get that information.
Well, right now that's we don't have that eligibility out as of yet. You have the sort of the list of criteria. Right now, our major limiting step is the amount of vaccine, and as that ramps up, we'll be increasing our eligibility criteria. And then making that public when specifically people are eligible. And then so we will be publishing things as far as phone numbers go, and potentially web-based access. But of right now, there isn't a phone number to call because currently that individual is not eligible to receive the vaccine.
Okay, got it. Thanks. Second question. Given the vaccine is currently only approved for adults 18 plus or 16 plus, what is the plan going forward with respect to schools, kids support, daycares, etc.? Will this run through the younger cohorts similar to what chickenpox used to do? Given that children typically have mild symptoms, what is the plan for this significant portion of Manitobans that will remain unvaccinated after doses are available and widely administered?
Yeah, so I mean, the plan is still what it is right now. We provide safe places in schools for the kids to return. We have not seen a lot of transmission, so we'll continue with those plans. Time will tell whether the eligibility criteria over time will include those under 18 and 16, as you mentioned. It's just very early. We've really never had access to a vaccine, an effective vaccine this quick. And so we're going to roll it out as where the science directs us to. But over time, we may expect that the eligibility criteria could expand as we get to learn more and more about the effectiveness of this vaccine in the younger cohorts.
From the Winnipeg Sun, Scott.
Winnipeg Sun. Question about lots of reports this weekend of people having being forced to line up. Well, forced, I guess, is subjective, but having to line up outside of malls, outside of other stores due to capacity limits. It's obviously, I mean, you mentioned in your preamble about it being quite cold and frostbite in minutes and that sort of thing. I guess the you tell me what is the advice there for both malls and or other stores and for people who are wanting to line up to get into a place like that.
Yeah, I mean, I think it's we're back at the level of risk. So we have those capacity limits because we know this virus is going to be transmitted in indoor crowded places. And so we just can't have indoor crowded places. So if a lot of people are attending at once, then that might mean a lineup outside. So I would certainly encourage people that if you're going out and you're planning on staying in line outside, if there was a line, and then ensure you're appropriately dressed and protected to limit your time out there. But we know there just isn't much of an alternative. We can't eliminate the capacity limits at this point. We'll have too many indoor crowded places, and we'll start seeing transmission of that virus.
Yeah, fair enough. Second question regarding, and I know in previous orders when it came to breweries, brew pubs, tap rooms, all that, because of different licenses, they didn't really fall under restaurants, or not all of them did. Will they be included in the restaurant reopenings, or are they going to be included in different orders? Do you know yet on when it comes to those different types of licenses?
Yeah, for that, we're going to have some real specific information on that later in the week, probably as early as tomorrow. And so we'll address all that then.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. About the change to the active cases, is the number of cases you provide us still probably overstated?
Yeah, it's probably still mildly elevated. It's tough to know the exact number there. But as we were closing these, we were, again, cautious that we weren't closing cases that might still be active. But this is a much better representation of the active case numbers than we had to offer last week.
It appears the Church of God has held an in-person service again this weekend without social distancing and engaging in activities such as singing. What sort of message does it send when public health doesn't do anything about something like this?
So remember, public health provides advice and can certainly and writes the the restrictions. Enforcement is not what necessarily public health. We have an enforcement update coming up tomorrow, and so there'll be more details on that.
From CBC Manitoba, Ian.
Good afternoon, Dr. Roussin. Ian Frey, CBC. Considering how low the case counts have been in the last week or so, could we see an even further loosening on private gatherings, either inside or outdoors, beyond what was in the draft last week?
So we're going to provide that specific information tomorrow. So I don't want to speculate on anything. So tomorrow we'll be able to provide the details of exactly what these orders are going to look like.
Thank you. And the federal procurement minister says over the weekend that the temporary Pfizer vaccine delays are largely behind us. Does this change our timeline estimates for February in any way?
You know, the Vaccine Implementation Task Force has done a lot of, planning, a lot of work to deal with these, anticipated, shortages or supply chain issues. And so we'll, as vaccine comes in, we're ready to administer it. And so we're ready for different scenarios where we can ramp up, as quick as we get vaccine in. And so we'll just, we'll have to see exactly what we receive. And as we receive it, we'll be able to get it into Manitobans' arms.
From the Canadian Press, Kelly.
Hello. I just want to confirm, have any variants been identified in Manitoba thus far?
No variants of concern. And so with these RNA viruses, there's, you'll see many, many variants. So we've been genotyping this since March of last year. So there's many, many different variants out there, but none of them are significant. They, they don't result in more transmissibility or severe illness. But we have not seen any of the variants of concern in Manitoba, the ones that you hear about UK, South African, or Brazil.
So comparing the first to the second wave, are we seeing longer hospitalizations due to COVID-19? And if so, what does that tell us about the pandemic?
We see a certain subsect of patients that are requiring longer stays within hospital and ICU. Remember, our first wave was, when you compare it to the second wave, was quite small. So it's hard to compare a lot of what we see in our second wave to our first wave, which we really didn't have significant numbers. We do see that these, our ICU numbers are not coming down as quick as we wanted, and it's because of that, small yet significant proportion of patients in ICU that are requiring lengthy stays. And so, I don't think there's been any significant change in the virus. It's just that we've had a much larger second wave compared to the first wave.
From CTV Winnipeg, Mason.
Hi. If there is so little transmission happening in dance studios in Manitoba, why not have them open this week, since it provides an activity for many children?
Yeah, I think that we've looked at a number of things, right? And so the easy answer is that we can't open everything at once, right? Every interaction can lead to transmission, and the more interactions we have at the population level, increases that risk. So again, we see this with essentially every sector. And every individual business where they see that their own business, the way they've been functioning is very low risk, and they may not have seen transmission in their own business. But again, we're not dealing with just one business. We're dealing with a multitude of businesses all open at once, some maybe not following things as well. And again, when we have everything open, or not even everything open, when we have loosening of restrictions like we saw in October, we get November numbers, and nothing's changed since then. So there's no reason to think that if we go back to where we were in October very quickly, there's no reason to think we won't be back at November numbers. So we have to be very cautious. We know that there's a lot of places just waiting to open up. A lot of places are doing a tremendous job at protecting Manitobans, but there's just no denying what we saw in November. When we open everything up, we get November numbers.
And do you think this extreme cold could create a rise in cases since people are being stuck inside in close quarters?
It's part of the reason why you see seasonality with a number of the respiratory viruses, because it tends to promote more crowding. And so, I think that Manitobans, we've learned, from October and November, that we have to be cautious. We can't be in those enclosed spaces for prolonged time, crowded places. We need to be extra cautious. So staying home is still an important tool. When you go out, ensure it's not a crowded place. We're wearing a mask indoors. And most importantly, staying home when you're ill.
From City News, Stephanie.
Hi, Dr. Roussin. Stephanie Lasuk from City News. I just wanted to quickly ask you about Moderna. No vaccine delivery from them this week. In the past, health officials here in Manitoba have spoken about our unique geography and how Moderna kind of benefits us in that way. So just how much of an impact do these Moderna delays have on us here in Manitoba?
Well, I think any delay has a significant aspect to us, right? The only limiting factor for our vaccine program right now is receiving vaccine. And so that's what's limiting us. There's nothing about the vaccine program that's limiting. If we can get vaccine, we can get vaccine into Manitobans' arms. So Moderna, Pfizer, any other ones that are going to be approved, that's our only limiting step right now. So all of these delays have that impact. That's the only thing that's delaying us getting vaccine into Manitobans' arms.
Right, but what are we seeing in some of our northern and remote communities that rely on Moderna? Are they having to cut back on appointments at all? What is kind of the actual effect there?
Yeah, and so if we're talking about First Nation specific things, we'll, I'd direct that to the Vaccine Implementation Task Force, or, Dr. Marcia Anderson had been out speaking to that as well.
From CHVN, Taylor.
Hi, good afternoon. We've spoken with a lot of churches over the past few days, all of them saying that they were hoping for more than 10%, most noting that it's not going to make a difference for them and it may not even be worth opening for. Now, as you are now seeing and have seen in the past, some churches get frustrated and take things into their own hands. How do you respond to that?
Yeah, I think it's again, this goes back, and it's not a slight on anyone. I think that many different sectors, many things that are important to people, they perceive it as less risky. They perceive the things that they've done as very safe. And in a lot of circumstances, people have stepped up and done a great job. But we've been here before, right? We've been here in October, and you saw what happened in November. So we continually hear about how safe everything is to open up and operate, but our numbers don't describe that. Our numbers in October show it's not safe to open everything up at once. And our restrictions show us that they work. Compare us where we were in December to right now. And it's all because of the restrictions, because the Manitobans been working hard to follow them. So we have to be cautious. Prolonged indoor contact is where this virus flourishes. And so we're going to be very safe with this. We have a lot of respect for the safety protocols that have been put in place. But again, it's not a reflection on people's work. It's a reflection of the virus.
And we're seeing people volunteering to hand out food, warm clothes to folks who are on the street and in bus shelters. When people are going out doing that, how can they stay safe?
Yeah, and so I think wearing a mask at all times, making sure you have access to hand sanitizer, doing whatever you can to maintain that physical distancing, avoiding crowded conditions, especially indoors, and really just those fundamentals. They're translated into every situation. They might look different in every situation, but the fundamentals can apply everywhere we are.
Our final reporter this afternoon from the Steinbach Carillon, Jordan.
Good afternoon, Dr. Roussin. Jordan Ross with Carillon and Steinbach. What is the test positivity rate for the Southern Health region?
Yeah, and so we typically don't go into the region by region test positivity rate because of such a variability, because of the relatively lower number of that. So I don't have that in front of me. We do know that overall our test positivity rate in all our regions have been trending in the proper direction.
And in November and December, you were asking all Manitobans who could to work from home. Is that still your advice, or could you update that advice for people who are maybe looking at lower case counts and wondering about returning to the office?
We're still in a very risky spot, right? Like these numbers, this trend is what we want. As we increase our interactions, we can expect cases to go up. And so just as we're in a position to start reopening things cautiously, we're again looking forward to receiving more vaccine to start protecting more of the vulnerable Manitobans that are out there. And so whatever we can do to minimize our risk, which is minimizing our risk for people around us, we should do that. So people who are able to work from home and it works for them and works for the business, then I would encourage you to continue to do so. There's no reason to needlessly increase our risk at this point.
Thanks, everyone. This concludes today's media briefing.
Thanks.